When I think about the opioid epidemic in Rhode Island, I think the most powerful aspect of the epidemic is that it really does affect everyone in Rhode Island. So regardless of age, regardless of what town you live in, regardless of your economic status, race, ethnicity, it's very personal, it's very tragic, but it's also very preventable.
As a certified prevention specialist in Providence, I have seen the overwhelming need to work with our diverse community to understand and be aware of the overdose issues in the city.
There's been an enormous change in a very quick, small period of time. We've seen prescription opioid overdoses, which comprised about 2/3 of the overdose deaths in 2009, to change to now more than 80% of our overdose deaths are illicit drug involved, and now only 20% are prescription opioid only. We've seen overdoses nearly double in the state in that same period of time. This is over 1,000 people in 5 years in a small state of 1 million people.
We have seen a significant increase in the number of folks admitted to treatment with opioids, either heroin or other opioids as primary drug of abuse.
So many parts of the state have been affected that had not seen overdose deaths at the kind of caliber that we're seeing. So it has changed in its composition and the kind of drug overdoses we're seeing in terms of being more illicit, younger people involved, and geographically reaching beyond the urban centers to our suburban and rural parts of the state.
The Drug Overdose Prevention and Rescue Coalition started meeting in 2011 when drug overdose prevention was identified as one of 4 priorities of the Rhode Island Department of Health Injury Prevention Program. What we really wanted to do was convene a diverse group of stakeholders, including the treatment and recovery community, other state agencies, first responders, and the first charge of the coalition was to develop a strategic plan.
The governor really stepped in and said, I want a plan. I want a strategic plan. You've been doing great work, but consider that the floor. We want a ceiling plan, a plan that, if we put money into this, this could have an immediate impact and reduce the amount of overdoses by 1/3. That's the goal.
The governor decided to reinfuse an existing task force with new, vibrant task force members. And so with that opportunity was a very concentrated period of time of strategic planning and providing some direction from an academic and an activist and aware advocate perspective, how the state could really provide new direction and new leadership. So it's been a fun, very quick, less than 90 days experience in that strategic planning process that could not have happened without the coalition's initial work.
It's really a united front that we try to approach this problem with. So we've worked closely, especially with the Department of Health, but also the Office of Health and Human Services and our Medicaid office and partners in making sure that we are funding the things that we need to fund adequately to get people into treatment, to give people access to naloxone, and especially with the Department of Health in terms of working with physicians to understand prescribing practices that they can change or alter, or ways to use the tools that we have to monitor current prescribing practices in order to reduce the number of folks receiving opioids.
We have many proven strategies that we implemented, like drug take-back day, to reduce access to prescription medication, school-based education, and training session with the senior citizens to help reduce medication misuse. Our community understands this is a complex issue and not unique to Providence or Rhode Island, but our approach needs to be tailored to address the needs of our diverse community.
I think the coalition is a reflection of law enforcement, of community activists, of people in recovery, people actively using, researchers, clinicians, and nurses, first responders, and we really have an opportunity for different perspectives to be represented in the coalition, and that's thankfully reflected now, I think, and carried up to the task force, where we have the leaders across the state in taking their seats around a table, not in a hierarchical fashion, but really in a partnership. So every single one of those partnerships is important for our coalition, our community voices, as well as for the leaders who are going to be setting the course for action.
The Governor's Overdose Task Force came up with a strategic plan by working with Brown University, both Dr. Tracy Green and Dr. Josiah Rich, who are two people that from Brown University that I absolutely trust, to really look at it in an academic way and to kind of find a plan, a strategic plan that can be measurable and can have a quick impact. So that plan is in process. It's actually in the governor's office, and it should be released quite quickly, but it's got 4 components of it that will make a quick impact.
I think prevention plays an essential role in reducing the number of people who are impacted by the overdoses epidemic.
My focus and our department's focus is working on the prevention efforts in the community. We do fund community coalitions and student assistance programs to work with youth and families and communities to educate and to make sure people are aware of the issues and try to identify areas where we might have problems, but then to give people access to the treatment that they need to address the issue. We also, I think, want to make sure that the treatment system that we have in place is best to meet the needs of the individuals that they serve. So we're constantly looking at avenues of opening up access to treatment and making sure that people are being referred to the appropriate treatment. And then our job is to make sure that when people get to treatment, they're receiving quality treatment. And we want to make sure that our providers are using evidence-based practices. Research is key.
It changes the nature of the conversation when people have a personal experience or have a gut feeling about something, and you can say, well, what we're seeing is this. How do we reconcile what we're hearing from perhaps one element and what we're seeing in the death data in another? So that kind of conversation can only happen with data as the objective bridge, and it allows us to have a richer conversation.
The major success of the coalition is it's really all about building capacity, giving people a space to meet, talk about drug overdose prevention, keep it on the forefront, stay engaged, identify opportunities for collaboration. Right now I think it's all about kind of taking advantage of the current momentum to make a real impact on the opioid overdose epidemic.
I saw it already. I've seen it happen in that room. People are excited and eager to participate, and that's different than what I've seen before. One of the benefits of the Governor's Overdose Task Force that was convened by Director Montanaro and Dr. Alexander Scott is they put 40 people at the table. These were policy makers. These are movers and shakers. Every state is doing that, and every governors are talking to each other. What are you doing? Our department talks to other states. What are you doing? What's working? When I go to other states, they want to know what Rhode Island is doing.
I think Rhode Island is heading in the right direction. We need to continue to support our young people who are not using or are just beginning to experiment with substance, with the skill and strength not to become one of the many people who have died or suffering during the strong overdoses in Rhode Island.